Join me in welcoming Dr. David Wilcox. Hey, David, how you doing today?
Doing great, Steve. How are you?
I'm doing really good, thanks. So tell us a little bit first about who you are and what you do in the world.
Sure. So I am a doctorate prepared nurse, which some people have trouble wrapping their heads around, but I am a nurse with a doctorate degree. And what I do is I'm a healthcare disruptor. So the things that you want to ask questions about in healthcare, I have the clinical knowledge and I'm the person asking those questions in the room. Things like when the insurance company is denying your claim, how do you handle the insurance company? When you're faced with high prescription drug prices, how do you lower them? I'm the person who disrupts those models.
So, what is the difference in the levels of nursing? Because I know you can do like a 2 year, a 1 year, all the way up to doctorate. So, kind of explain that to us that don't know.
Okay, and every role is valuable. So you start with your licensed practical nurse, which is about a year's worth of training. And then you have your 2 year associate prepared nurse. It's about 2 years of training. And then you have your bachelor's, which is 4 years of training. And then you have your master's of science in nursing, which is another 2 years of training for a total of 6. And then you can get your doctorate, which means you've been training for about 8 years.
So, by the time you've gotten your doctorate, what really is the difference between a doctorate nurse and a doctor?
So a medical doctor can diagnose. A doctorate nurse would be like the top nurse at a hospital. A chief nursing officer would be a doctor prepared nurse. Not all chief nursing officers are doctor prepared, but many of them are.
And so, nurse practitioners, are they a hybrid between them, or is that what the doctor? I'm so
Sure.
lost.
Yeah, I understand. So a nurse practitioner is actually a master's prepared nurse that can diagnose and treat and falls more along the same lines as a medical doctor. In fact, nurse practitioners are going to be the answer to the clinician shortage in this country.
That's really interesting. So, a RN, a registered nurse, is that the 4 year level?
An RN could be a 2 year level, a 4 year level, a master's prepared level, or a
Oh, okay.
doctorate. I'm also a registered nurse.
Okay, all
Yeah.
right. It's just really interesting because I guess I just never, you never ask your nurse, but you always make sure your doctor has his plaque up on the wall, right?
Right, exactly. I've got several plaques up on my wall.
Although the flip side to it is, I've often joked, it's like, nobody ever asked their doctor, did you graduate first in your class at Harvard, or were you the guy that barely squeaked through the door at, like Joe Bob's University?
No, but you can always check their quality outcomes on the Centers for Medicare and Medicaid Services website, cms.gov, and you can see how they're rated quality wise. So that's the most important thing, because even if if they graduated top of their class, they may not have good judgment and they may not be rated as high as possible. You might want that other guy at the bottom of the barrel there to take care of you because he may have better quality standards. So that's one of the things I try to tell people right off the bat. You're hiring your care team. It's not the other way around. They don't hire you as a patient or a consumer. So you need to check and make sure and do your research to make sure you're going to get the best care possible.
Well, let's then jump into talking about your book, How to Avoid Being a Victim of the American Healthcare System, a Patient's Handbook for Survival, because I think that one that you just said is a really great tip. I mean, I think a lot of us just feel like whatever our insurance company tells us is the doctor we're going to, that's the doctor we go to.
Right. So yeah, there's the in-network piece of it, right? So, but even that gets dicey, and I talk about that in the book a little bit. Like I know somebody here who had a surgery done, and they made sure that they were in network at an in-network hospital with an in-network doctor, and the anesthesiologist was out of network. And when they got done with the surgery, they got a bill for $10,000. So some things are beyond your control. You can tell your insurance company or your hospital that you only want in-network people to work on you to decrease your costs. But a lot of that goes on in healthcare. And that's the main reason why I wrote the book. I think it's really interesting that it comes from a nursing perspective, because, the doctor comes in the room and he sees you, Steve. He diagnoses you, and then he hands you to me or a nurse. And we're the people who hold your hand while your loved one's dying. We're the people who go into those innermost spaces. So having this written by a nurse is taking you into some innermost spaces. I've had some people say that they've had to put the book down because of some of the stories in it and just digest it, because they're like, wow, how can something like that happen in a hospital? And so, the healthcare is complex, and it's not accidental. It's complex for a reason by the entities that are buying for your healthcare dollars. And trying to break that down into layman's terms is what this book is all about. How does the average American understand what's going on? How do they understand that, hey, you can bag up your medications at home and take them to the hospital with you if you're going in non-emergently, and they can use your medications and you'll save yourself some money. They're not going to charge you $25 for a Tylenol. There's all kinds of tips in here. I have little nursing knowledge boxes that break it down into a brief synopsis of what the chapter's about. But it's just, I want to educate as many people as I can. I mean, as nurses, we want to make sure that you have the best outcomes. And so that's why I wrote the book. And that's why I think it's important to hear it from a nurse as opposed to a medical doctor.
That makes total sense too, because just even thinking while you were saying that, I was thinking it's like, I could name, maybe not by name, but I could think of incidences where I've had really bad doctors. But I'm trying to think if I've ever really had an instance where I've had a really bad nurse.
Yeah, I'm sure there's some out there, but thank God I've never run into them.
Right? I think it's a totally different way that they come at the world. You know what I mean?
So we have to mop up a lot after the doctors, right? So if something doesn't work right and you have to mop it up. So I share a story in the book about, I was in the grocery store in my local community and I heard these two women talking, and one woman said to the other, I'm going to go to the hospital and get my procedure done by Dr. So-and-so. And I'm like, oh Lord, because I had taken care of some of Dr. So-and-so's patients and they did not progress as rapidly as his partners. And, you just know, being in healthcare, you know who these guys are, right? That's why I go back to that star ratings and CMS, because then you can know who these guys are too. But anyway, in the frozen food section, I'm thinking, God, should I say something? What do I do? Because here's somebody who I know is not going to have a fun time with it. And so she comes waltzing by me with her shopping cart. And I said to her, I couldn't help but overhear your conversation. And she said, oh yeah, I'm getting this procedure done at the hospital by Dr. So-and-so. And I said, so I can't tell you who I am, but I work at the hospital and you really should find a different doctor. His patients don't do as well as the guys that he works with. And she just looked at me, just drained it. And she said, thank you, as I was walking away. And when I saw her at the hospital, she was under the care of another doctor. But healthcare is complex, right? Because if I was prepping her for surgery, Steve, and I said something like that to her, that would have been totally inappropriate, and the hospital could have fired me for it, right? So, I mean, that's the difference between a nurse giving you the information and a doctor or somebody who's up here.
Sure.
Yeah.
That makes a lot of sense. So what kind of things do you dive into in the book?
Well, I've got, actually, it's kind of funny. I've got one part of the book that if you're going to have surgery, what are the questions you ask your surgeon? So not a lot of people know that surgeons in teaching hospitals sometimes don't even do your surgery. It's an intern or somebody practicing, right? So the first question you want to ask is, are you going to be the one to do my surgery? The second question you want to ask is, am I going to be the first case that day? Statistically, you do better as the first case. And besides the fact that you can't eat or drink after midnight, I don't know about you, but I like to eat. And so I don't want my surgery at 5 o'clock in the afternoon when I'm standing between this doctor and happy hour. So, those kind of questions people never think to ask. And it's funny because my neighbor got a hold of the book and then found out he had to have a hernia surgery. And so he actually asked the surgeon all these questions, and he came back to me and said, the guy looked at me like I had 3 heads. He said, you could see his wheels spinning. Who is this guy talking to? Because he was prepped. He didn't go in there just, put me on the schedule, do my surgery. He was an active part of his healthcare. He was directing his healthcare. He was hiring his team. And, that kind of knowledge, we're all going to need healthcare at some point in time. That kind of knowledge is essential to the American public, especially if you don't have a nurse in your network. Another piece of advice I talk about in the book is find a nurse in your network. If you don't have one, find a friend who knows a nurse, take them to lunch, connect with them on social media. I can't tell you the number of people that text me, hey, I'm on my way to the emergency room and here's what's going on and things like that. It's always good to have somebody who's looking out for you in your network. The other thing that I talk about too is, we talked about insurance company and high priced drug medications, but what does a better system look like? So under our current system, it's called fee for service, which means when you show up at the hospital, you're going to make the hospital money. You're going to make your doctor money. They're going to run a series of tests on you and collect. So during COVID, when nobody was going to the hospital, well, we're still in COVID, but when nobody was going to the hospital, the taxpayers were bailing them out, right? There's this little known healthcare system called value-based care that's delivered by accountable care organizations. And basically it's a network of providers, physical therapy, registered dietitians, doctors, nurses. And what they do is they're incentivized. They get a certain amount to care for you, and they're incentivized to keep you healthy and keep you out of the hospital. So that's the way to get your care delivered. So how do you get into an accountable care organization? Well, you could do a Google search to find out if there's one in your area, and usually there is one in your area. And then you can ask your doctor, are you part of the accountable care organization? That sends a very strong message. That message is, if you're not part of the accountable care organization, then I need to go to a doctor that is, because the statistics show that I'm going to do a lot better if I'm cared for under this capitated model or value-based care, and I'll be healthier and out of the hospital. And not, when I read a research report, only 25% of Americans know that this exists. I could go on and on about value-based care because they tried to get it into the infrastructure bill. So during COVID, when we were bailing hospitals out to keep their doors open because nobody wants to lose access to care, value-based care organizations saved $4.1 billion. And they wanted, in the infrastructure bill, they wanted a value-based care act put in there because they thought they could save an additional $313 million over the course of the bill. But it was not included. I read what was included from healthcare, and it was not included, even though it would have helped pay for the infrastructure bill. So there's a lot of shady stuff going on behind the scenes because, fee-for-service model makes a lot of money, right? So, and if it doesn't, then the taxpayers come by and bail you out. So, but value-based care is something that'll keep you healthier. And I would strongly encourage every American to get into a value-based care model.
So, what is the number one thing you want people to take out of having read this book?
Yes, I want them to learn how to be a better partner in their healthcare. I want them prepared for those situations when the insurance company tells you, heck no, I'm not paying the bill. So there is one area of the book where that happened to me. I was settling an estate of my aunt's. I'm in Charlotte, North Carolina, and she lived in Syracuse, New York. And insurance company was not moving on it. And they would say, you have to call this person. They're on vacation. You call 40 minutes later, you get disconnected. And so I asked a friend of mine who's a medical doctor, what do I do in this situation? He said, yeah, you want to call the senator's office. I said, senator's office? And he said, yeah. So I called the senator's office, waited about 30 seconds, got an aide, told the aide what was going on. And he said, oh, we've got people over there. We'll take care of this for you. 5 days later, I got a note saying that they were going to cover it. And 2 weeks later, I had a check. But not a lot of average Americans know that the political system can be an advocate for you as well, because they're tied in to healthcare insurance companies or pharmaceutical companies, because they're taking money in their campaign contributions, which is why some of this stuff that really should move through and legislator does not move through. But the book, I want people to be an advocate for themselves. I want them to be well educated and knowledgeable and be prepared for the shady characters they're going to run into in the American healthcare system.
And the book is called How to Avoid Being a Victim of the American Healthcare System, A Patient's Guide for Survival. There's the cover of it. I'm going to put a link in the discussion in the chat for people who didn't see it in the description. So you can get it today for free on Amazon. Leave us with some concluding words here, David, on some things we can do to not be a victim of the American healthcare system.
Well, again, it's all about proactive education. The American healthcare system is so complex. There's so many different aspects that I could get into, but globally, what I want Americans to hear is you have the power to be a partner in your healthcare. You don't have to do whatever the doctor's telling you, or even the nurse. You have to research and think it out. One of my aunts just recently was told by a surgeon that when she went to get her license renewed, she couldn't do it because she has cataracts and they needed to come out right away. And she said, "What do you think about that?" And I said, "Well, you drive 5,000 miles. She drives all these timeshares, right?" I said, "You drive 5,000 miles all summer long." I said, "How's your driving?" And she said, "Excellent. I don't have any problems with vision." And I said, "So there you go. You don't need them taken out. Your body will tell you when it's time to have them taken out." And so this doctor's obviously trying to drum up some business for himself. But that's the kind of stuff I want people to avoid. I want them to be educated enough to be able to say, "You know what? I have no problem with my vision right now, and I really don't need my cataracts out." And do it when you start to have vision problems. It's just it's just that education piece that, not a lot of Americans know. They get into the healthcare system and then they think to themselves, "Boy, this is really messed up." And they get hurt. I mean, medical errors was the third leading cause of death before COVID. Medical errors, the third leading cause of death. I mean, this is serious stuff, guys. And so I would encourage you, while we have the book free out there, please go pick up a copy and read it, because, I just want you to be knowledgeable and able to access the system and be safe.
Well, David, thank you so much for the book, and thank you for spending some time with me here on the show today.
Thank you, Steve. I enjoyed it very much. Thank you for having me.